Hi, this is Tony Preston. I'd like to talk today about temporal bone anatomy and physiology. This is a model of the temporal bone. If we look at it from a lateral view, we can see that it has a squama, it has a mastoid body, a mastoid tip, which is a little bit small in this model, the external auditory meatus, the hole for the ear, the zygomatic process, which is this section of the cheekbone that you feel just in front of your ear. If I look at that same model in an illustration, if you look at your netters, or if you have one of my illustrations, the temporal bone is here in red. Again, we have the squama, this big flat piece, the mastoid body, the mastoid tip. On this one, the styloid process, the external auditory meatus, and zygomatic process. Okay. If we look at the bottom of the cranium, we have a temporal bone, again, here in red. That temporal bone has a petrus portion here, a mandibular fossa, zygomatic arch. Here is the OM suture, the occipitomastoid suture, and the parietal notch. We're looking at the bottom of a temporal bone here. We see the same pieces. We see that there's a petrus portion, mandibular fossa, zygomatic arch. This would be where the OM suture is. This particular model doesn't have a styloid process on it. The styloid process is actually a tooth-like structure that kind of fits into the temporal bone. It's not really a piece of the temporal bone, but it is usually included in temporal bone anatomy. If we look at a full model here, we'll see that here's the mastoid tip, there's the styloid process, here's the OM suture, here's the zygomatic arch, here is the external auditory meatus. There we go. Okay. Now let's look down into the cranial vault. If you look into the cranial vault in the illustration first, we have the squama out here. We have the spheno-squamosal pivot about here. This is the petrus ridge through here. The parietal notch, the interior OM suture, the jugular foramen. Okay. If I look at the temporal bone, once again, we have, here's where the OM suture would be. Here is the petrus portion. Here's the squama. And this would be where the spheno-squamosal pivot is, about right here. So here is the cranial base, the inside of the cranial vault to the floor. Here is the petrus portion of the temporal bones. Here is the squama out here on the edges. There is the OM suture down here. There's the jugular foramen. Here's where the sphenoid and temporal bone come together, and the spheno-squamosal pivot will be about right there. So temporal bones, when we talk about physiology through the craniosacral cycle in the osteopathic model, they have a movement where the SBS here rises and the temporal bone rotates out. So we have this this pivot here becomes important, that it pivots here and it also pivots down on the condylosquamomastoid pivot. So let's look at those for a second. Here is the occiput. It's here in the cranium. If we take a look at that, this temporal bone fits right in here. And as the occiput moves into flexion and rotates forward, this temporal bone rotates on an axis along the petrus portion so that it actually kind of moves a little bit anterior and then rotates lateral. So this would be flexion and extension. Let's take those same pieces and look at what happens with the sphenoid. Here you can see how the sphenoid and the temporal bone fit together. There's this pivot here, the spheno-squamosal pivot, that allows it to turn and locks it the other way. So we see that the SBS, which would be here, rises and the temporal bone rotates. So flexion and extension. Of course, these movements are very small and not really easily seen by the average eye while it's happening. Okay, if we're looking at them together, we would see that these temporal bones, here's the petrus portions, that the temporal bones sit on the side of the head like this. They kind of go forward and rotate out and back, and go forward and rotate out and go back. Okay, that's a short overview of the anatomy and physiology of the temporal bone in the osteopathic model. I'm Tony Preston.